You know, feminine health, so many questions. It can be tough to find good answers.
Yeah, for sure.
We got a request to look into non-surgical vaginal tightening.
Interesting.
Seems like a lot of people are curious about it. So we're going straight to the source, this FAQ page from the Women's Health Clinic.
Okay.
I like this page because it's not just some random blog.
Yeah.
It's been approved by Dr. Joe Daniels, a gynecologist, lots of experience.
His expertise really comes through.
For sure.
They've made a complicated topic really clear and easy to understand. Like, they knew exactly what questions people would have.
Okay, so non-surgical vaginal tightening, what is it exactly?
So imagine you could rejuvenate those vaginal tissues, improve tightness, elasticity, all that, but without surgery.
No surgery.
That's what this is all about. It uses lasers or radiofrequency. They stimulate collagen production.
Right.
And that collagen is what makes those tissues strong and resilient.
So it's like giving your body a boost to make more collagen.
Exactly. It's using the body's own healing power. And the great thing is, it's minimally invasive. No cutting, no general anesthesia, way less downtime than surgery.
That's a big plus for a lot of people.
Mm-hmm.
But how do the lasers and radiofrequency actually work?
Okay, picture this. These devices, they give off focused energy that heats up the tissues, just a little bit. Not enough to cause damage, but enough to trigger that healing response. Part of that response is making more collagen.
So it's like tricking the body into thinking it's injured, so it starts repairing and making collagen.
Exactly. Pretty smart, right?
Yeah. Okay, so we know what it is, we know how it works.
Yeah.
But why? Why are people interested? What are the benefits?
That's where it gets interesting. Big benefit, improved comfort, especially for women who are dealing with dryness or maybe even mild incontinence. And let's be honest, for many women, there's also the potential for better sexual satisfaction, more confidence.
Yeah, feeling good down there makes it feel good overall.
Absolutely. Impacts self-esteem, relationships, the whole thing.
Now, who are the ideal candidates for this?
Great question. If you're someone who's recovering after childbirth, experiencing age-related changes, dealing with menopause, or just looking for non-surgical options for rejuvenation, then this could be something to look into.
So it could potentially benefit a lot of women.
Yes, but it's important to remember it's personalized. What works for one person might not be right for another.
Speaking of personalized, let's talk about Dr. Joe Daniels, the expert behind this FAQ.
Yeah, he's a gynecologist in Yorkshire, and his focus is pelvic floor dysfunction. He's done some really cool research on how laser treatment can help with pelvic health. He has an impressive GMC number that's like a doctor ID in the UK. And he's a member of all sorts of organizations, like the Royal College of Obstetricians and Gynecologists.
So we know this information is coming from a reliable source, someone who really knows what they're talking about.
Definitely.
And speaking of reliable sources, the FAQ mentions some big names in healthcare backing this type of treatment.
Oh yeah, they specifically talk about the American College of Obstetricians and Gynecologists, ACOG, and the UK's NHS. They have really high standards, and they're all about evidence-based medicine. So their support for non-surgical vaginal tightening definitely means something.
That's good to know. It's reassuring.
For sure.
Okay, this FAQ has a ton of info, but they also offer a way to get even more advice, right?
Right. They have this Ask Our Nurse thing. You can literally email them any questions you have, and a nurse will get back to you. Accurate, confidential information.
That's a great resource.
Yeah, it's like having a personal guide through the whole process.
So the Women's Health Clinic is really all about giving women good information, helping them make decisions about their health.
Absolutely. They've created this resource that's not just informative, but also really easy to understand and supportive.
Okay, so I think we've laid some great groundwork here. We've talked about what non-surgical vaginal tightening is, how it works, who it might be good for.
Right.
And we know this information is coming from a really good place.
Yeah.
So with that solid foundation, I think we're ready to get into some of the details.
Sounds good.
What can someone actually expect during the treatment itself?
Yeah, let's talk about that. It's a pretty quick and easy procedure. It's outpatient, so you go home the same day.
Oh, good.
The treatment itself takes about 30 to 60 minutes.
Okay.
And most women say it's pretty comfortable.
That's good to hear. What about after? Any downtime?
You can usually go back to your normal activities right away.
Oh, wow.
You might have a little swelling or tenderness for a few days, like that soreness you get after a workout.
Yeah.
Oh.
Down there. Okay, you mentioned earlier that the treatment helps produce collagen. Why is collagen so important for vaginal health?
Well, collagen, it's like the building block for so many tissues in our body,
Right.
including, the vaginal walls. It
Yeah.
gives them their structure, elasticity, strength. But as we get older, or after things like childbirth, we naturally produce less collagen,
Uh-huh.
and that can lead to changes in, tightness and elasticity.
So this treatment is kind of like a collagen boost. It helps those tissues get back that youthful resilience.
Exactly. And it's not just about tightness, it can improve lubrication, sensation,
Okay.
so more comfort, and potentially even better sexual pleasure.
Okay, that makes sense. Now, we've focused a lot on the positives, but no procedure is completely risk-free, right?
Mm.
What are some of the downsides, side effects?
Yeah, you're absolutely right. Non-surgical vaginal tightening is generally safe, but like any procedure, there are some potential risks.
Okay.
Most commonly, a little pain, swelling, redness, maybe some bruising at the treatment site.
Uh-huh.
Usually goes away in a few days, though.
So those sound pretty manageable.
Yeah.
Are there any more serious risks that we should be aware of?
In very rare cases, there could be complications, like infection, scarring, changes in sensation.
Okay.
That's why it's so important to find a qualified, experienced provider, someone who uses FDA-approved devices and follows all the safety protocols.
So doing your research and finding a good provider is really key.
Absolutely.
Okay. Now, the FAQ mentioned that non-surgical vaginal tightening can help with mild stress urinary incontinence. That seems like a big plus.
Yeah.
Can you explain how that works?
Sure. So stress urinary incontinence, SUI, is when you leak a little urine when you cough, sneeze, laugh.
Yeah, that's pretty common,
Mhm.
especially after having kids.
Right. Happens because the muscles and tissues that support the bladder and urethra, they get weak,
Uh-huh.
and that allows those leaks to happen. This treatment can actually help strengthen those muscles and tissues so you have better bladder control.
So it's tightening the vaginal tissues and addressing the root cause of the problem.
Exactly, like a 2-for-1 benefit. And since it's non-invasive, minimal downtime, it's a great alternative to surgery.
That's fantastic. Really promising for women who struggle with this.
Definitely. And I know we've talked about Dr. Daniels already, but his expertise here is really important.
Yeah.
He's not just any gynecologist. He specializes in pelvic floor dysfunction, which is exactly what we're talking about here.
His research is really interesting, too.
Oh, for sure. His work at Imperial College London focused on using MRI to understand pelvic floor problems, including urinary stress incontinence. And it was through that research that he really got interested in laser treatment for these issues.
So his expertise comes from actual research and experience.
Exactly. And the FAQ also points to the endorsements from ACOG and the NHS.
Yeah, those are organizations known for their high standards and their focus on science-backed healthcare.
Exactly. They don't just endorse anything.
Right.
So their support for non-surgical vaginal tightening really says something.
It definitely adds another layer of, I guess, reassurance for people thinking about it.
Right.
We talked about the Ask Our Nurse feature earlier. What kind of information can people get from that?
It's great for personalized advice.
Yeah.
If you have questions about whether it's right for you or specific things that the FAQ didn't cover,
Yeah.
just email them. Email protected. A qualified nurse will get back to you. Accurate, confidential information.
Like having a direct line to a healthcare professional.
Yeah. It shows that the Women's Health Clinic is really committed to helping women understand their options.
Okay, so we've talked about the benefits, the risks, the expert behind it all, and even extra resources for those who want more guidance.
Yeah, we've covered a lot.
What are the main takeaways you think people should remember?
I think the main one is that non-surgical vaginal tightening is a safe, effective, minimally invasive option for women who are looking for vaginal rejuvenation.
And it's especially good for those dealing with age-related changes, recovering from childbirth, or going through menopause, right?
Right. It can also help with mild stress, urinary incontinence, and it can even potentially improve sexual satisfaction and confidence.
But it's important to remember that results can vary, and finding a qualified provider is key.
Absolutely. Do your research, ask questions, make sure you're comfortable with your decision.
Before we move on, I want to touch on something else the FAQ talks about. Realistic expectations. What does that mean in the context of non-surgical vaginal tightening?
That's such a good point. This procedure can make a big difference, but it's not a miracle cure.
So don't expect to feel like a brand new person overnight.
Exactly. And it's not going to replace a healthy lifestyle. Good pelvic floor exercises are still important.
Right.
And if there are any underlying medical conditions contributing to vaginal laxity, those need to be addressed too.
So it's a tool to be used along with other healthy habits.
Exactly. That's why talking to your healthcare provider is so important. Be open and honest about your needs and goals.
Yeah.
They can help you decide if this is right for you and set realistic expectations.
I love that. It's about making informed decisions, taking a holistic approach to your health.
Absolutely. And I think the Women's Health Clinic does a fantastic job of helping women do that.
Well said. Okay, we've covered so much in this part of our deep dive. The procedure itself, the importance of a qualified provider, setting realistic expectations.
Yeah, it's been a great discussion.
It really does. Like, they've thought of all the questions someone might have. But before we wrap up, there's one more thing I wanted to mention. The FAQ actually gives references to, like, studies and articles
Yeah.
to back up what they're saying.
Yeah, that impressed me too. It shows
Yeah.
they're committed to using real evidence, not just, making stuff up.
Exactly. It's like, here's the proof. They even cite this 2017 study from the journal Climacteric. It looked at how effective laser therapy was for treating genitourinary syndrome of menopause, which can cause a lot of discomfort.
Right.
And they mentioned a 2018 article from Sexual and Relationship Therapy about radiofrequency therapy for vaginal laxity and sexual dysfunction.
Yeah, and there's also that 2019 consensus statement published in Lasers in Surgery and Medicine.
Oh, yeah.
It talks about all the different ways lasers are used in gynecology,
Yeah.
including vaginal rejuvenation.
So if anyone wants to dive into the research, they've got the links right there.
Yeah, it's great. They're really helping women understand the science behind it all.
Okay, so as we wrap up this deep dive, I want to leave our listeners with one last thought. We've talked about the physical benefits, improved tightness, comfort, even helping with incontinence.
Yeah.
But what about the emotional and psychological impact?
Oh, that's so important, and I think often overlooked. Feeling more confident, comfortable in their own bodies,
Right.
it can make such a huge difference in a woman's life. Relationships, self-esteem, that feeling of empowerment.
It's not just about the physical changes. It's about feeling good in your own skin.
Exactly.
Right.
That shouldn't be underestimated. So if you're considering this treatment, think about the whole picture, how it could impact your quality of life, not just the physical stuff.
That's a great point. Think about the whole picture. Well, I think that's a perfect place to end. Knowledge is power.
It really is.
And this deep dive has hopefully given you the information you need to start making those decisions about your health. If you want to learn more, check out the full FAQ on the Women's Health Clinic website. Thanks for joining us on this deep dive.